Good afternoon, everybody. Prynawn da. I'm Dr. Frank Atherton. I'm the Chief Medical Officer for Wales.
And I'm Dr. Rob Alford. I'm the Chief Scientific Advisor for Health for Welsh Government, and I'm the co-chair of the Technical Advisory Group. Today we'll update you about the latest public health situation in Wales and talk about the 4 new variant strains which we're closely monitoring. Frank will start with an overview of the public health situation.
Yeah, thanks, Rob. So in Wales, we're starting to see the beginning of an improvement in community transmission of coronavirus, and that's a continuing trend which we've seen really since the start of January, about the 8th or 9th of January. We're seeing cases steadily falling in the community, and the 7-day case rate that we always talk about has been dropping steadily for the last few days. It's currently about 200 per 100,000 population, and that's about a third of where we were in the 2 weeks before Christmas, when it was well over 600, about 650 cases per 100,000. So we are seeing a reduction in community transmission. And the good news also is that it's falling in all parts of Wales. Every local authority for the last 2 days has seen a falling rate. Alongside that, the case positivity rate, that's the proportion of cases that are tested that prove to be positive, has been reducing. It's about 14% at the moment, and we believe that the R number in Wales is less than 1, which means that the epidemic here in Wales is shrinking rather than growing. The R number is somewhere between 0.7 and 0.9. So all of that tells us that the infection is slowing and that the size of our current outbreak is shrinking, and that's obviously very good news. And it's thanks to the lockdown, which we introduced here in Wales on the 20th, and to everybody who is obeying those rules and following them rigorously, because that's what's keeping us safe, and that is saving lives. So thank you to everybody who is complying with those rules, difficult though we know they are for everybody to follow. It's positive news, but we're not out of the woods, and the rates are still far too high. 200 per 100,000 is way too high, and we're still seeing that in terms of pressure in the NHS. You'll remember, I'm sure, that there is always a lag between what happens in the community and what happens in our NHS, our hospital services. Hospital services are holding up and holding up well. They are stable, but they're very busy. And again, thank you to all the staff who are working so hard to keep people here in Wales safe. The NHS is under sustained pressure, but there are some signs of stabilisation. And as I say, there's always a lag, but the easing of demand in the NHS is something that we can hopefully look forward to as the community rates continue to fall. We're also seeing some improvement in critical care, which again is busy but stable. So the numbers are not shooting up as they have in some other parts of the UK, and that again is good news. That's not to say that the NHS isn't very, very busy. It clearly is. So where are we with vaccination? Well, the latest figures for vaccine coverage were published just before this briefing, and we currently have vaccinated, given a first dose of vaccine to just over 312,000 people here in Wales. That's a shade under 10% of our total population. And that's been done in a few short weeks. It's a magnificent achievement to all those brilliant teams working between health and social care and supporting everybody in Wales. So thank you to them for their great work. It's real progress, and we are seeing day-on-day increases in the numbers vaccinated and week-on-week progress as well. So coverage is improving markedly. We're still focusing very much on those priority groups that were outlined by the JCVI, and we're working our way through those to make sure that everybody, particularly those people living in care homes, the most vulnerable, and care home workers, frontline healthcare staff are all vaccinated as our clear priority. We're on course to meet the first milestone of offering vaccines to our first priority groups by the middle of February. That was the commitment we made in our coronavirus vaccination strategy published just at the start of this month. So big thanks to all the teams working so hard on vaccination across Wales. In terms of where we go now with restrictions, the First Minister will be speaking on Friday about the outcome of the 21-day review and will give some further information about where we go for the future. What we have learned in Wales and the rest of the UK is that if we relax our measures too soon, even though we have improving pictures an improving picture in the community. If we relax our measures too soon, we know how quickly the virus can resurge, and we need to avoid that at all costs. So I'll hand over to Rob, and he can just talk a little bit about some of the new strains, because I know there's been a lot of interest in new variants of coronavirus. Rob.
Thank you, Frank. I think the first thing to say is mutations arise naturally in the SARS-CoV genome as the virus replicates and circulates through the human population. As a result of this ongoing process, many thousands of mutations have already arisen since the virus emerged in late 2019. The vast majority of these mutations have very little or no effect on the virus, and only a small minority of them are important and change the way the virus behaves. Some could change the virus's ability to infect people, making it more contagious, or making the illness more severe. Mutations can also change the way the virus interacts with the immune system, including the response generated by vaccines. We pay particular attention to mutations in the spike protein, which is associated with viral entry into cells and is relevant to immunity and vaccine efficacy. In the autumn, a new strain emerged, and we know this as the Kent variant since it was first picked up in southeast England. As you know, changes in this particular strain have made it more contagious than the forms that were previously circulating. Since it's emerged, it's quickly spread across Wales and become the dominant strain in most parts of the country. It is now present in all parts of Wales, at least 50%, and highest in parts of North Wales. We believe the strain has been driving higher rates of cases seen over the Christmas period and into the new year. We've heard or read comments in the news in the last week that the Kent variant is more deadly. There have been 3 studies looking at death rates associated with the strain, but we're not yet able to say that definitively. We can at this stage say that the new strain is more contagious and travels quickly, causing more people to catch coronavirus, which in turn may put the health system under more strain. We're closely tracking 3 other variants which have emerged in close succession in South Africa and Brazil. To date, there have been 10 cases of the South African variant identified in Wales, all of which have been imported from people who have travelled from abroad. The emergence of these new variants poses new challenges for us because they may alter the course of the pandemic, possibly speeding up the rate of transmission and quickly increasing the number of people who have been infected. A concern is that a new variant could emerge which won't respond to treatments and vaccines, putting us back to where we began. We're an active member of a consortium of genomic experts from public health agencies and academics across the UK called COG UK, which has been set up to inform our understanding and response to SARS-CoV. And thanks to the incredible efforts of Public Health Wales, the percentage of positive samples sequenced in Wales is the highest in the UK and globally. We're working very closely with partners across the UK and to develop our approaches to detecting, monitoring and evaluating the new variants. I'm going to hand back to Frank now, but I'm happy to take questions about the science behind the pandemic. Frank.
Yeah, thanks very much, Rob. Just wanted to finish by reminding all of us about how we should make sure that we keep ourselves as safe as possible as we carry on rolling out this massive challenge of getting vaccines to everybody. We are vaccinating at an unprecedented rate. It's something that we've never done before at this scale in the UK. And these vaccines are some of the most effective vaccines that we've had available. But obviously no vaccine is ever 100% effective. And so there are some things we know about the vaccine. We know that it gives good protection against serious illness, against hospitalization, against people dying. But what we don't know yet is the extent to which it can stop the transmission from person to person. And so while we still have these very high rates of coronavirus in our communities, and while we have these dominant strains, the Kent strain, which, as Rob has been describing, is more transmissible than the original strain, it means that there's still a very high risk that the virus can be transmitted from one person to person. And we know that the virus thrives on contact between humans, between people. As I've said, we've had more than 312,000 people who've had the first dose of the vaccine. But irrespective of whether people have been vaccinated, whether you've had a vaccine or whether you haven't had it, it's really important that we keep ourselves safe over the next few months while the whole programme rolls out. And at the moment, I'm afraid that means that we should all be staying home. Lockdown continues. We need to protect the NHS and we need to save people's lives. If we do need to go out, we need to think hands, face and space, as we have been doing for some time now. And it's critically important, of course, that if people do have symptoms, that they stay home and arrange to get a test. And those people who test positive or who are identified as a close contact of somebody who has tested positive really have to self-isolate very rigorously. If we all do that, we can keep Wales safe, we can protect ourselves, protect each other, and we can get through this together. So thank you very much, and now we'll, as usual, take questions from journalists, and all our answers will be broadcast on social media channels. And I think, first of all, we have Mike Griffiths from ITV Wales. Hello, Mike.
Hello, Dr. Afton. Thank you very much for that. My first question would be on the over 80s target. We know that was missed for the 70% by this Sunday, weather cited as one of those reasons. What is your revised target? And in the event of more bad weather as is forecast this weekend, what can we do to mitigate any further disruption?
Yeah, well, I think the Minister's spoken to that, yesterday, and the First Minister spoke to that. The over 80s was never a target. In our vaccination strategy, we had a number of milestones and a number of markers, and the key markers that we've been looking for are, to get through those groups 1 to 4, of whom all the over 80s are a key, really important member by the middle of February. So we currently have, last figures I saw, about just over 52% of the over 80s are vaccinated, but within that other group, the people living in care homes and people who are working in care homes, over 70% of those have now been vaccinated. So we're making solid progress on those, and the intention still remains to get through all of those first 4 priority groups by the middle of February, and we believe we're on track for that. So that's what we'll be monitoring.
Just as a follow-up there, we've been filming today, a colleague of mine at a vaccination centre in Cardiff, various couples who've been there, and they expressed some concern that the youngest in that couple, all over 70, some in their 80s, the youngest may have had an appointment that day, the other hadn't been contacted yet. And we know it's very ambitious what we're getting through, a lot of people who need to be seen. But what can you do to reassure people that they're not going to be left behind if the other person has?
Yeah, well, thanks for that, Mike. And, inevitably, when you have a programme of this scale and this complexity, there will be, a bit of variation between health boards. I fully expect to see that. But the health boards are all absolutely clear about who the priority groups are. They have been communicating with local authorities. Letters should have gone out to everybody, advising them about when they will get their invitations. People are on registers and so will receive those invitations. Inevitably, some over 70s will start to be invited in some health boards before all the over 80s are covered. But we're well on track to get through those first 4 priority groups. So that's kind of where we are now. Thanks very much, Mike. And we have Hugh Thomas from BBC Wales.
As the 2 people giving the scientific advice to ministers, what do you think case rates and positivity rates should get down to before reopening primary schools, secondary schools, and then other areas like shops and hairdressers?
Yeah, thanks, Hugh. It is quite a complex, equation, and I don't think there's any absolute cut-off that I would point to when we can start to reopen things. What I would say to you, and I do say to the First Minister and to the Health Minister, is that we need to learn from what's happened when we've come out of previous lockdowns, the lockdown in March, the fire break in November. And what we saw there was that even though rates came down quite well, when we released things, we released them in a way which allowed the virus to re-establish itself very, very quickly. And so, as we do get some more headroom for releasing these measures, what we need to do is to release things very cautiously. Ministers have been very clear that getting schools back to face-to-face learning is a very high priority. So that will be one of the things that we aim to do first. I can't give you an absolute figure, at which we would say that the figure is suitable now to start opening schools. But we need to look at three things, really. We need to look at the community transmission rates, which we talked about today. We need to look at the capacity within the NHS and to make sure that we don't get into a position where the NHS is overloaded. And we now need to look, of course, at the percentage of people who are vaccinated, who have vaccination cover. So it's a bit of a complex equation rather than a single figure, I would say, Hugh. I don't know if Rob wanted to add anything to that.
Yeah, thank you, Frank. We need to be very careful with the new variant and monitor its progress. It looks like it grows faster and it looks like it retracts slower. So we need to consider that in the complex modelling that we do. Thank you.
Hugh, did you have a second question?
Yeah, Dr. Orford, on that point, really, you mentioned the variants. In your advice that you're giving to ministers to government, how much caution are you having to exercise about easing restrictions, because you simply don't know whether a variant that's here or that may arrive is going to be resistant to the vaccine and potentially put us back to square one?
Well, we're monitoring the situation very closely. We've got a very good handle on the variant that's dominating in Wales at the moment, and we're looking at the dynamics of that and how it could potentially evolve if we release measures too quickly. So we're more confident in that one. We're working very closely with academic partners and public health agencies across the UK, and there's an incredible consortium called COG UK that's well tuned into the mutations, of which there are thousands actually. So there is a very good concerted effort at UK level.
Thanks very much, Hugh. And next we have Mark Smith from Wales Online.
Thank you very much indeed, both. This is probably a question that either of you could answer. With most parts of the country now reporting infection rates below the 200 cases per 100,000 population, is there an argument for perhaps reintroducing more localised lockdowns in a bid to give greater freedoms to areas with lower prevalence rates? Or do you believe a Wales-wide approach to easing lockdown is the most sensible route going forward?
Yeah, thanks, Mark. It's something that we always keep under review, and we do have local incident management teams at local levels, giving advice up on a daily basis to Welsh Government. My personal view is that we're better sticking with a Wales-wide approach. We are geographically a large place, but population-wise, we're only 3 million people. We learnt from you'll remember back to the Caerphilly was the first area that went into a local restrictions, and we have learnt a lot from those local restrictions. And one thing we did learn is that things move around very quickly, move around the country. We've talked before about whether we should have a north and a south division, and we've seen the virus move very quickly from the south of Wales up to the north of Wales. So I think it moves so quickly that an all Wales approach, to my mind, remains the best hope for us. Did you have a second question, Mark?
I do indeed. Thank you very much. And secondly, on the variants, do you believe that some of the new variants of coronavirus, particularly the infectious Kent strain, are having a greater impact on people who are young and were otherwise in relatively good health before they contracted the virus? And would you, obviously you mentioned the South African variant and the fact there were 10 people in Wales who'd had it, but would you be able to tell us what you know about that variant and potentially how infectious that is, or is it still too early days?
Rob, you want to?
Yeah, thanks very much. We're closely monitoring the dominant variant as it is at the moment, the new variant in the UK. That doesn't seem to have any difference in the way that infects people across the ages, which is really positive. Wherever there is an opportunity to mix, there will be transmission, so we need to be very careful how we open up. And of course, we're looking at the other variants, the one from Brazil, the two from Brazil and the one from South Africa, very closely and asking the same question. As always, the more data that we've got, the more confident we can be in how we react to that, how we assess their impact and how we respond to them.
Thanks very much, Mark. And Dan Bevan from LBC. Hi, Dan.
Good afternoon, Dr. Atherton and to yourself. Dr. Orford, good to speak with you both. This question is for the both of you. Yesterday I spoke with Kelly and Emma Hennessy from Merthyr Tydfil. They're two frontline workers who both contracted coronavirus and very sadly lost their father to COVID-19. He's one of 100,000 people across the UK who have now died with the virus. And of course, Those people can't be brought back, but we need to learn those lessons that we've had throughout the pandemic in order to minimize fatalities between now and the end of the pandemic. Were there any points where your advice wasn't followed by the government, where you wish it had, or do you regret any of the advice that you've given?
Daniel, look, thanks for that question, and thanks also for reminding us, that behind all these statistics, over 6,000 people in Wales have lost their lives, and behind each of those statistics, there's a family and a grieving family. So thanks for reminding us of that. Your question is a really good one, and we have to always learn from experience. Looking back, and there will be inquiries and look-back exercises on all of this. And but if I was to pick out one thing from that I wish I'd known, earlier in the pandemic, it was that the virus behaved in a different way to how we expected. It took a while for us to learn about the virus. I mean, it was brand new. Humanity had never seen it before. And we started off treating it rather as we treated, pandemic flu. And this virus has behaved very differently to pandemic flu. And I think had we known that, we would have made some different decisions about, looking after people in care homes, etc. So that's the one thing that, I do think back to. I don't think it was a mistake. I think it was the limits of what we knew put boundaries around how we responded. And I feel that really quite strongly. But I wish we'd known then what we know now. Rob, maybe you have a thought on
Yeah,
that.
thanks very much. And just to echo Frank's sentiments, that this period will be punctuated by thousands of personal tragedies, and we mustn't lose sight of that as we go forward. There have been incredible efforts across the UK to harness the benefits of science to help us lead us through the pandemic and minimise the impact. You mentioned that there were 2 nurses that you spoke to, that the NHS and the health service and social care have gone to incredible lengths to protect people and to look after people. And so have many individuals across Wales have made their own personal sacrifices and given up their liberties and their freedoms to help all of us fight this infection. In terms of Welsh Government, the discourse has been incredible. There's been very active conversations about the science, and it's been a very positive engagement. Thank you.
Thank you very much, both. I appreciate that answer. And once again, this question is for the both of you. It's clear from what you've been saying today and also what ministers have been alluding to that it's very unlikely that there's going to be any major changes on the lockdown announcement on Friday. But that's going to be very difficult to hear for people who are already quite lonely and vulnerable. Can you give them any sort of, glimmer of hope that if the rates continue to fall in the way that they have been, that in 3 weeks' time, they might be able to see some family and friends again, whether that's inside or out. But if that's not the case, what do you think is the most sensible first easing?
Yeah, thanks, Dan. Look, I absolutely take your point that the current lockdown is really difficult for everybody, but it's most difficult for those particularly who are living alone, and that's why we do have allowances for people to have social bubbles, so that they can join in another household and people don't remain completely isolated. So that would be my first thought. The second one is I don't want to preempt what the First Minister might announce on Friday, obviously, but I think you've heard what I've said, which is that my advice is that the opportunity, the headroom for relaxation is really quite limited at the moment, and we do have a 21-day review cycle here in Wales. So towards the end of February, we will look again at where we are with community transmission, where we are with the NHS capacity and the busyness of the NHS, and where we are with the vaccination. So that will be the time to think about further relaxations. But again, I've said it, the first priority of ministers has been expressed many times, which is to move children, back from the blended learning, the online learning, which they're currently pursuing, back towards some form of face-to-face learning. That would be a key priority, I think. Rob, anything to add?
No, I think very sensible. Thank you.
Thanks very much, Daniel. Nice to see you. And Aled Scowfield from Newyddion.
Round out to you both. I've got a couple of questions on the vaccination programme, if that's okay. Newyddion has spoken to families across Wales that are concerned that elderly relatives over the age of 80 that are housebound have been unable to get vaccinated yet. I've spoken to one woman from Carmarthenshire this morning who has elderly parents in their late 80s that are still waiting. Now, her father is visited 3 times a day by carers who also haven't been vaccinated. Is that a cause for concern? And what measures do you think need to be taken now to make sure that elderly and vulnerable people who are housebound aren't left behind in the race to be vaccinated?
Yes, thanks very much, Aled. And, you know, as I've said, this is a programme of enormous complexity, but the absolute priority is to get to those over 80s as soon as we possibly can. Everybody's circumstances are different. Local health boards are putting in a range of different ways of getting vaccine to people. We have mass vaccination centres, community vaccination centres. We now have GP. We have over 300 general practices now providing vaccine using the AstraZeneca vaccine. We do have mobile teams as well across Wales. So there's a whole range of ways that people can get the vaccine. It's really down to the local health board to make sure that all of those, and the people that you mentioned, that get their vaccination as soon as they possibly can. I would imagine that would most likely be through the AstraZeneca vaccine, because you can move that more easily to the person rather than bringing the person in. And so if somebody is housebound, the local health board will need to work with the GP to make sure that somebody can get out there and give that vaccine. That would be the process there, I think, yeah.
My second question relates to people who aren't in the priority groups being vaccinated. Newyddion spoke to a healthcare worker yesterday in North Wales who has daily contact with patients. Now, she raised concerns that office-based council staff have been vaccinated ahead of her and elderly patients. Do you accept that concerns of those nature can damage the integrity of the vaccination process and people's trust in it? And do you have concerns that potentially people are jumping the queue when it comes to getting vaccinated?
Well, I do have concerns, you know, if we're not, because we are committed here in Wales to following the JCVI guidelines and those clear priorities. Now, obviously, there's 2 issues at play here. One is that there is you know, some blurring of the boundaries, and there are always kind of specific cases that can be brought in, you know, to and specific reasons why an individual might need to be vaccinated from perhaps a group, you know, further down the groups rather than further up the groups. So that may well be at play. The other issue is that the JCVI guidance is really quite broad. We are trying to make that clearer to health boards, and I'll be writing out to them this week to try to provide a bit more clarity around that as well. And the third thing, actually, I would say is that it's really important that we don't waste this precious commodity, the vaccine that we have. You know, and there are instances I know where, you know, at the end of vaccinations schedules, there may be a few vaccines left over which should be used, because the worst thing would be to throw a vaccine away. My advice, you know, is always, if there is a small amount of vaccine left at the end of a schedule, we need to have reserve lists in the health boards, and we need to get people in so that we can use the vaccine. So inevitably there are glitches in the system, but by and large the basic advice is that we have to stick to the JCVI priority groups, because as you rightly allude, I think, you know, we're not a nation that believes in jumping the queue. I think, you know, we have a clear priority. We should wait our turn. We should get vaccinated according to that schedule. Thanks very much, Alan. And I think the next person is, we've got Steve Bagnall from the Daily Post. Hello, Steve.
Hello, how are you doing? Thank you both. My questions are probably for Dr. Atherton. Returning to the issue of schools, we've seen a lot of disturbing reports from parents worried about their young children and the impact of lockdown on them, nightmares, physical ailments, even sadly expressions of self-harm. Have you seen anything in the data to reflect this? And how concerned is the government about the impact of closing schools on the mental and physical health of children? And are we heading for bigger problems regarding this in the future?
Yeah, thanks very much, Steve. So there's a lot of consideration being given to this, absolutely. And yeah, the government absolutely understands that there are a number of issues at play here for children and young people, and indeed for their teachers and for their parents and carers. You know, first and foremost, we worry about the impact of, you know, the different educational methods, people having moved to online learning. You know, works for some, doesn't work for all, so there's a real risk that we could be widening educational inequalities, and that could lead to problems in the future. So we do worry on that basis. And also, as you rightly say, we worry about, for perhaps a minority, but for for a minority of children, about, significant mental health harms, the sort of things you describe. And we've tried to make sure that there are services and systems of support through schools. Teachers are still working hard to support young people, and that needs to continue. But, just to reassure you, I think it's the third time I've said it in this conference, which is that, for ministers, I constantly hear that education, getting back to some face-to-face learning is really a top priority for government. Thanks for that.
Thank you. And following on from that, obviously you've talked about support being offered to parents. What measures would need to be in place for schools to reopen? Should we be vaccinating teachers sooner? And if this continues, could there be a need for children to just repeat a year?
Well, the issue of vaccination is an important one. The JCVI has not gone down a process of looking at different occupational groups. We had some quite good news for teachers this week when ONS kind of reported on the death rates of different segments of the population, and the good news, of course, is that teachers had no greater risk than the general public. So that's really positive. So. I think, the question about which occupational groups should be prioritised one before another will be way down the road. We have to get through the 9 groups that we've already identified through the JCVI in the first case, because those are the people who are most vulnerable. Those are the people who will benefit most. And, we are a country which believes that we should target our resources to the people who can get the best benefit or who are most at risk. So we will continue down that route, and that discussion about other professional groups, I think, is for later. Thanks very much, Steve. And finally, I think we have Tom Magner from Carers World. Hello, Tom.
Hi, good afternoon, Dr. Atherton, and also good afternoon, Dr. Orford. I'd like to look at the thinking behind vaccine priorities. I suspect there's both a science and a medical angle to this, so I'd like to hear from both of you, if I may. And can I say at the outset that when I refer to carers, I don't mean paid care workers, but unpaid carers. It's clear from the First Minister's reply to a question from a member of the Senate, Dennis Jewell, yesterday, that the Welsh Government is sticking rigidly to the JCVI vaccine priority list. Leaving aside politics, this must mean that both of you are advising ministers to do just that. Now, this advice keeps all unpaid carers firmly in band 6, leaves to one side those who are unpaid carers looking after people in the higher priority bands, such as Band 4, for example. The very real fear among our viewers is that vaccinating only the clinically extremely vulnerable person in, say, Band 4, leaves the other person at greater risk of exposure to COVID-19. To many of our viewers, the question is, are you really saying that this risk in Band 4 to the unvaccinated, unpaid carer doesn't exist, especially given the growing number of variants? And if you acknowledge there's a risk, that you consider it's one worth taking? Or do you consider, with respect, that Band 4 unpaid carers are simply trying to jump the queue?
Well, I don't regard it as queue jumping. I think, every case has to be looked at on its merits, Tom. We are looking quite carefully at where carers, paid and unpaid, sit within the prioritisation list. Some carers, by virtue of their own health conditions, of course, will be, in a group by themselves. There is license through the JCVI guidance, I'm sure you've seen it, that carers who are supporting people who would otherwise be particularly vulnerable or left stranded if their carer became sick, that they could be vaccinated under the group 6. So there's still a lot at play at that, and I think more conversations that we need to have with the sector to really kind of understand the nuances of the points that you make, and we will continue to do that. But you're right, your basic principle is right. It's the one about we should target our resource towards the most vulnerable, and we will continue to do that. That's my advice to First Ministers. I think that was the basis of your question. Rob, I don't know if you wanted to add to that.
Thank you. Look, there are still some things we don't know about the vaccine. The efficacy, how well it works actually when it's deployed in the field, its role in preventing onward transmission needs to be resolved, and how long it confers protective immunity. There's a very good news story in here that in Wales we're the 5th highest in the world in delivering the vaccine, and that's because of enormous efforts of a lot of people. it's important that we vaccinate, and we're seeing that that's speeding up every day. So we should see this as a success story, but there will be glitches along the way, which we need to overcome.
Tom, did you have a second question?
I'm sorry. Yes, do have, Dr. Atherton, as it happens. One of our viewers, this is looking at it in a slightly different way, one of our viewers sums up the position, in her opinion, that the true impact on unpaid carers is stuck between data and understanding. If you look at that, for example, on Independent Sage, their briefing last week, I asked about the comparison between mathematical modelling that it's based on and real life. I mean, are you prepared to look at this issue on the basis of real life as opposed to mathematical modelling, and therefore maybe pick up on the nuances you referred to in the JCVI advice?
Well, the way I would deal with that, Tom, is to say that, for the time being, we have a pretty clear route through this as to who should be the priority, and that came from JCVI. If you want to call that mathematical modelling or science-based, but it was based on who was at the highest risk of dying. I think once we get through those, certainly the first 4 groups and possibly the groups 5 to 9, there is scope for further thinking about what are the criteria that we should be employing before then. We are committed in the UK and here in Wales, of course, to getting vaccine to all eligible adults by the autumn, and so within that we will need to think after we've done the first 4, got through the first 9 group priority groups, where we go and how we make further prioritization. And I suspect, Tom, that will go back to JCVI for some input, but it won't just be on a technical scientific basis. It will start to play in some of those questions that you have, some of those perhaps more ethical, more moral questions about how we roll out a vaccine, and how we should best deliver that for the population of Wales, because ultimately the vaccine is just a tool to try to keep us safe. Thanks very much, Tom, and thank you everybody for your interest and for everything you're doing to get the messages to people about how we can keep ourselves and our loved ones safe here in Wales. Thank you very much.